fall down, we get banged up, but the scars show what we made of. Don't need to die, lift your head up, shake the dust off, tell me what you're made of. I can't hear you breath, that our lungs beating our heart. But pick the first you got something to say. It's a brand new day. 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 When the rain falls, when the ground shakes, and the wind blows, when your heart breaks, show me sorrow, show me laughter, show me starlight, show me what you're after. I can't hear you, that our lungs beating our heart. Listen to the voice you can say, it's a brand new day. 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 See the sunrise. Don't look the dark. It's a time we are the It's a brand new day. It's a brand new day. It's a brand new day. It's a brand new day.
Certain cats.
Hello everyone. Assalamu alaikum jami'an. My name is ZAID QADDOUMI, Sales Manager of Cardiac Rhythm Management of Abbot in Saudi Arabia. First of all, I have a short story just to introduce what is Abbot. For the people who are in this room, when you are mentioning Abbot to them, everyone will think about the cardiology. But in public, when someone asks me, where do you work? I tell him or her that I'm working at Abbot. But when they re-ask, what is Abbot? Here I have to think in a strategic manner. First, I have to classify him or her. She's single or married. If he is a married one, then I have to think about his kids. And I have to ask him, do you have kids? He will answer, most probably yes. Then I will tell him, do you know the Similac? He will definitely say yes. So I'm telling him that we are the manufacturer of Similac. If he's a single, none of us experience the medications. So when he's a single, I ask him, did you experience the ibuprofen? He will tell me yes. So we are the manufacturer of this. When he is not a single, or he is married without kids, you will just ask him or her, do you remember the COVID? And none of us forget the COVID. So we are the ones who manufactured the rapid tests when you get your test results within 15 minutes. So this is Abbot in short. And when I thought how to present Abbot here to the people, this video was as a shortcut to all of these questions. But to talk more about Abbot internally, how is the structure inside Abbot? One of the wise colleagues in our company, when I asked him what's the best description for Abbot, he told me it is we take care of people from delivery to delivery. So we are starting from birth to death. Internally, Abbot is distributed into 6 main divisions. The first one is the nutrition, and for example, the Similac as a product or key product. The diagnostics, and everyone knows the lab tests, and everyone knows the COVID-19 rapid diagnostic tests. The third division is the medicine, and the Profen is a very well-known product for Abbot. Diabetes. The diabetes, it's one of the leaders in the diagnosis of diabetes or measuring with continuous glucose monitoring for the glucose level. Neuromodulation, we have products to treat the patients with the chronic pain. For patients as well who are suffering of Parkinson, epilepsy, dystonia, etc. The cardiovascular, and here no need to go more deep because everyone here is engaged with the cardiology field and will know Abbot. But moving more forward, and today we are coming with different idea. It will not be more clinical or more educational, but I want to show you how is the technology is advancing and how is the technology is developing in the history, and how important is the research and development departments in the companies. Abbot, as a cardiology division, it includes 6 subdivisions internally. The first is the cardiac rhythm management, and all of you knows the pacemaker as a product. The electrophysiology, most of you will know the 3D mapping. The heart failure, which when someone asks, we tell them from outside the field, it is a heart pump, or it is a replacement to the heart, which is the HeartMate 3. The peripheral and coronary intervention, all of you knows the stents and the balloons. The structural heart, which is as well very well known in TriClip and MitraClip. But today, I want to go more deep into cardiovascular, moving from the monitoring until we pace inside the heart of the patient. So as a cardiac rhythm management, I usually, when I talk monitoring, I prefer to mention the implantable loop recorder. For those who don't know the implantable loop recorder, it is a small device to be implanted under the skin to monitor the rhythm of the patients. Why do we need it? Or what is the most common cause to use the ILR? When a patient comes with the symptoms, but it's not documented, or the physician, he put him on a Holter, but nothing appear in the Holter. When he use a patch for 14 days, for example, and nothing appear, here he will need for the implantable loop recorder. But how did it start? And as a timeline, in 2008, the first implantable loop recorder invented and released to the market. But the weight was 15 grams, which is, it is an invention for the first time to have it to the patients, but the weight is still, it is a bit heavy. It came with a remote monitoring, which means that I can monitor the patient while he's outside the clinic, which will reduce the flow of the patients or the headache on the clinic to give more slots for more prioritized patients, plus an average longevity of 3 years. Then, in the period of between 2010 and 2015, more developments from the departments of research and development by the companies came with more update, which lowered the weight of the loop recorder into almost 40 grams and a longevity of 4 years in average. More advancements in the technology came with more extra development on this therapy. So we have new features related to patient applications. Now the patient has access to his application on the mobile phone and connected over the Bluetooth. But today, where do we stand? This is until 2020. Today, where do we stand in the therapy of implantable loop recorder? On top of what we have mentioned, previously, Abbot last year kicked off its last, the last implantable loop recorder Assert IQ with a lot of technical features. But on top of what I have mentioned, for the first time to have an implantable loop recorder with more than 6 years longevity. Sometimes, or for the people who are not from the field, they will say, why do I need it for 6 years? But we have kind of patients who needs for the 6 years longevity. At minimum now we have this option in the market. Plus, on top of this, we have two very unique features. The first one is, can it provide the elevated heart rate, and if this heart rate was during activity or without an activity. And as I've mentioned before, now we reduce the flow of the clinic by remote monitoring. And I will call the patient only in two cases. Either there is an adjustment to the programming, or there is an evidence of arrhythmia and I need to call the patients. But what if I can program or do the necessary programming for the patient remotely? And this is what Abbot came with last year. So today, I will call the patient to come to the clinic only if there is a documented arrhythmia. And for shortcut and best description, where we were in the past and where we are today. In the past, we have the first picture, which is the bedside monitor, where the patient needs to hold it wherever he go, or he will keep it next to his bed, and at the end of the day, he will come to update to his physician. While today, we have a mobile application, and this mobile application will keep you connected with your physician 24/7. Not even this. Even if the patient, him or herself, felt with something abnormal, they just press on sending the session, and it will be arrived to the physician. Then the physician can decide what to do with the patient. And I remember a case 3 years ago. It happened here in Saudi Arabia for a patient. She was a female in Skaka. This lady, she came to one of the hospitals here in Eastern region. They implanted loop recorder. When she went home in Skaka, there is an alert received by the physician that there is a pause. Immediately, when this session record reached to the physician, he called the family immediately, and they took her in the middle of the night to the emergency, and he guided them what to do for her. And it ended up with a pacemaker implantation. And this is the value of the technology. My next story is the pacing. Now we are done with the monitoring, which is the heart monitoring. But now what about the pacing? After the diagnosis for the patient that he needs the pacemaker to pace. This is our first pacemaker, which implanted on 1958, the first implantable pacemaker. You can see the size of this is not the pacemaker itself. The pacemaker is implanted here, but it is connected on this small programmer. It's like an external pacemaker, but it was kind of invention to the humanity. And here you can see the implanted pacemaker, which is implanted in the body of the patient. This was 1958, but what about today? And what followed this invention? After that, the implantable pacemaker took different types and shapes and features by the companies to help and support the patient. But in 2013, there's a game changer It changed the game of the pacemaker. Instead of, or not instead, in addition or in parallel to the conventional or traditional or transvenous pacemaker, there's patients who needs for something they don't have an access, they have medical complications, so there is a solution for them, which is the leadless pacemaker. Thank you for what?
That's it.